Hi, this is Jonathan Marks, and I'm here with John Mitchell, PhD. He's assistant professor in the Department of Psychiatry and Behavioral Sciences at Duke University Medical Center, and he's a member of the Duke ADHD program. Dr. Mitchell is going to be speaking at the 2017 annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders. That's happening this January 13th to 15th at the Mayflower Hotel in Washington, D.C. His workshop is entitled Mindfulness Intervention for ADHD in Adulthood, and he'll be offering that for 2 hours at the meeting. John, can you tell us what's going to be covered in that workshop?
Sure. So the main objectives for people attending are going to be to define mindfulness-based interventions, establish what the evidence basis is for it as it applies to ADHD in adulthood, and then also to demonstrate and go through a session by session of what this mindfulness-based intervention might look like for adults with ADHD.
When you say going through the steps, can you just describe briefly this program that you'll be presenting?
This intervention is, what it does is it teaches adults with ADHD how to practice formal meditation, and it's adapted to also have an emphasis on how mindfulness practices, both formally and informally, can be applied in day-to-day life, particularly as it applies to ADHD behaviors. And so each session, there's formal techniques that are taught, so sitting meditation, some that involve movement or walking, but there's also informal exercises as well, and a discussion about how this all applies to ADHD behavior. And so when we have people coming in, they're learning how to meditate, and it's in the service of targeting what are the behaviors or the impact of those behaviors and how it's impacting them kind of in their day-to-day lives.
And there's been a question about the efficacy of mindfulness. I know you're going to be sharing evidence that shows the effectiveness of this kind of approach.
Yeah, there's small but growing literature on efficacy of mindfulness for adults with ADHD, and that's building on top of a very large literature using mindfulness for different psychiatric populations, different medical populations as well. And so what we'll be doing is talking about how mindfulness fits within that and kind of the broader framework of what are treatments that we know with ADHD that work and how does mindfulness fit in with them as well, and how to use mindfulness in your daily practice using that knowledge as a foundation for your approach.
Sounds wonderful. So this has been Dr. John Mitchell. He's going to be speaking at the 2017 annual meeting of APSARD this coming January 13th to 15th at the Mayflower Hotel in Washington, D.C. Thanks for being with us, John.
Thanks for having me.